This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com. Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series Video on Demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical.
Hey, everybody. Welcome to Ageless Health Livestream, and with yours truly, Dr. Tom. I have an interesting program for you. It's kind of putting the end piece of this program that we're going to be doing Wednesday night at the Roselle Center for Healing in Fairfax, the 11th, 6 p.m. We're going to be talking about neuropathic problems, where you can't feel anything, you hurt like crazy, your face is numb, your toes are numb, your fingers are numb. But the fact is that it affects every part of your body. And just because your toes are tingling, if you follow the nerve root all the way up and find out where the visceral portion going, meaning the organ system goes, you're going to find that that organ also is not getting the neurological input that it should. And the telltale sign to you is that you can feel it outside. You feel the numbness, the pain, the tingling, the soreness, the burning and itching and all those things. But it's also affecting you. Why? You have 31 pairs of nerves that come off your spinal cord. They divide like this into two. One branch goes to the organ system inside. The other branch goes to the muscle. So they're constantly talking to each other. And so we've mentioned many different things over the last few weeks leading into this program on Wednesday evening. But on Wednesday, it's going to be a very unique program. We're going to kind of tri-team you, not double team you or tag team you. It's going to be Dr. Scott Lamp, Dr. Jerry Cowart, and yours truly. I'm going to do the intro on this thing. I'm going to set the stage. I'm going to tell you exactly what really is going on. And then we're going to talk about mostly neurodegenerative conditions due to spinal injury, stenosis, degeneration, cramping the cord, and the other piece, and very importantly, is diabetic neuropathy. And the question is, how do you distinguish, between them? We're going to talk about other neuropathic problems as well and how they affect everything. But how do you distinguish what they are? How do you make a decision? Do you want to take medications the rest of your life? And the doctor said, well, we really don't have the tools. There's nothing that we can do about it. It's a progressive disease. You got to do this. You have to do that. My brain goes, I don't think so. Sounds like a lot of BS to me. But then I know a lot of things that most of you don't know. And understanding that the body has the capacity to reserve its capacity for injury, but resolve things no matter how bad it is, as long as you're breathing and you're duplicating cells in your system. We're going to talk a little bit about the fix today and reprogramming your brain. What can you do to fix your brain? What can you do to restore function there? And then we'll talk about the rest of your body on this Wednesday evening. It's going to be fun. So if you haven't registered, please do. Reach out to the office, the Roselle Center for Healing at 703-698-7117. That's 703-698-7117, and register for the class. We're about, a half a mile off the National Capital Beltway going west on Route 50 on Executive Park Avenue. We're real close. And I'm telling you, you're going to get more data, more information about this, and really you're going to get the bottom line on how to fix these things, because many of them can be fixed. And I should say most of them, the majority of them. The problem is that we get into lifestyles, particularly in this country, that cause us irreversible problems. And if we understand it, then we can put a fix to it. But let's talk about dysregulating our body's system, identifying what that is, and then let's figure out how we're going to fix this dysregulation. It's important that you understand what a dysregulated nervous system is. It's one that does not express its normal neurological target, its ability, its capacity, right? So when we understand that, it's not working the way it's supposed to, basically, it gives us another step. But we have to be able to identify it, and then we have to reprogram it. So there's things that you can do to reprogram the vagus nerve. The vagus nerve is what? It's the 10th cranial nerve. Cranial nerve, you got 12 of them. The vagus is the father, the mother, and the expressor of everything. It has an influence on every body system that you have. It has a parasympathetic and it has a sympathetic component. So what could you do to fix that? Somebody says, well, it's my vagus nerve. My vagus nerve has been all screwed up. Well, there's a lot of ways that we do it, but some things that you can do at home to make that happen. So if I told you, just sit there right now, and all I want you to do is quickly contract your toes, do a tight Kegel. You're going to pull your perineum up and hold it. And then I want you to use your tongue at the same time, and I want you to tickle the roof of your mouth. That's going to stimulate your vagal expression. Tighten your toes, do a Kegel, like you're holding back a bowel movement or a urinary pattern that you're going to say, I got to go, and you're holding in your wallet like that while you're sitting, and then tickle the roof of your mouth with your tongue. And do it repetitively throughout the day. How many times? Maybe 100. And it doesn't cost you anything, doesn't hurt anything, and you can do it on your own. Isn't it cool? And it will help. I promise you it will help. You take your ears and you begin to rub the upper portion of the ear, just like this. Get in and work it. And you just take it all the way through and work your ears on both sides. That will also help reprogram your nervous system. Little things, right? Real little things. How about doing other things to get you to articulate better? One of the things I do in an examination process, which you can do just to help yourself, is simply put your tongue to the back of your teeth like this and go la 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 la, and try to get it so smooth. Work on it. You're going to stimulate one of the cranial nerves. Or if you put your tongue way back and you go ga 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 ga, you do those kind of things ongoing, and tighten your toes and upregulate the Kegel and tickle the roof of your mouth. And now you've got some things that just doing those things will help you. But let's talk about other things that you have in your control that you can make a difference. All right. So things that destroy the nervous system are things that are negative and insulting and not stoppable to the system. Like what? Listening to bad conversations. Now, good conversations can be bad conversations when you're hearing them too often. And we've been doing that for years now. We listen to all the talking heads, and we get addicted. We go from one news program to the next, to the next, to the next, to the next, and they all say the same thing. If you heard it once, you've heard the whole story. Don't get away from it, and go find something that's going to make you laugh. Go listen to music. Listen to something that makes your body feel great. How about just sitting, have a conversation with your creator. Get real quiet. Say, hey, point me in the right direction. Help me out here. I need some direction. I need you to help me. Is that meditation? It's prayerful meditation. And prayerful meditation can be extended into looking at a symbol that means something to you. Somebody asked me, I grew up Roman Catholic, right? And somebody accused me, said, well, you pray to idols. I said, what are you talking about? And they said, well, you go into church and, you have all these statues and you have all these symbols around and so forth. And you get on your knees and you pray to them. I said, no, that's not what I do. I said, that reminds me of who I am and what I believe in. That's all. It's like carrying a picture of your family in your wallet. You want to look at your wife or your husband or your children, you pull this finger and say, oh man, look at those beautiful people. And it's the same thing. And people have gotten a little out of control with this, worshiping idolatry. So you got to really understand that you got to get in that quiet place. So you need a symbol that represents happiness to you. If you walk into one of my treatment rooms, I have a big tiger that I got when I was in China some years ago. And this tiger is magnificent, walking down the mountainside. And it shows power and beauty and strength and, this presence. And, I laugh all the time. I said, yeah, that's me. And then, when I sit and I get quiet, you know what I do with that tiger? I visualize it with a rose in its mouth. Yeah, my name is Roselle, right? It's actually Rosella. That's the family name. It's the rose. So I visualize it with a rose in the mouth. And so I see this tiger going down the mountainside with this rose in its mouth. And I'm saying, yeah, that's me. Power and beauty. The beauty's kind of going away after all these years, but nevertheless, so seriously, and if you walk into my office, you may be able to see behind me, you look up on the shelf, there's all kinds of little figurines of Yoda from the Star Wars, and my grandchildren and my godchildren and, anybody that, wants to get me something, they always get me a little Yoda something. And it's because the character of Yoda in Star Wars is kind of an interesting person. He's locked into the energetic, into the force, if you will. But what I'm telling you all that about, more that you have those things that give you positive feedback. Let's talk about reprogramming more. So what can we do to reprogram our nervous system? One is you need to get away from, as we said, the stress patterns. How many, you just don't go anywhere. You don't take a vacation. You don't go to, the mountains and just walk around. Just go for a ride. Years ago when my children were growing up, and I mean, to this day, they probably won't go for rides because of what we did to them. But what we did is that, Sundays was don't put anything on your schedule because it's family day. And we get up, we drag their butts to church and gave them a way. And then we'd have lunch together and we would engage our children and we get silly with them. And then we go for a ride and we go to the mountains and we go here and there. But it was a bonding, relaxing time. That love bonding with somebody. If you don't have anybody with you, go rent a kid someplace, or go someplace where there's other people who are positive, or you can add a positive piece to it. That will help your nervous system rest and repair itself. The sympathetic fight, flight reactions and so forth. So if you got things like you're suffering from headaches and excessive sweating and muscle ache and pain and difficult sleeping, you can't fall asleep, you can't stay asleep, you wake up in the middle of sleep, all the things that we normally see, your intestinal tract doesn't work, it's always an overdrive, the emotional pathways, the memory or cognitive impairment, your disassociations, and what I say by that, you don't feel connected anymore. All of those can be a result of the brain and the nervous system having been beat up for a long period of time. But guess what? You can resolve that and fix that. So we want to talk about that. We want to give you a few things that you can do other than go take this, go take that, just stuff you can do on your own. So what are we going to start with? How about if every day we get up in the morning, we have a glass of water, and we go for a walk? Just go for a walk. If you're a prayerful person, then pray while you're walking. If you're a meditative person, then focus on a symbol as you're walking around. 2 miles. I don't care how fast you do it. I don't care how slow you do it. Just go for a walk and do that. Then come back in, do a little stretching. I promise you, and I challenge you, if you do just that and you don't do anything else, you're going to find that you're going to upregulate your neurological responses virtually to everything that you have. So we're going to start with that, right? We're going to start with go for a walk. What's the next thing we can do? Let's breathe. While you're walking, breathe. How many of you breathe in your chest and not in your stomach? You have to expand your belly, and that increases your oxygenation and your energy. You got to purposefully try to relax your neck and shoulders. You have to put a headset on if you want to. Listen to some really good music or something that's positive, and guess what else you can possibly do to reprogram your nervous system? Give a hug to someone. If you're Sicilian like me, you're going to hug everybody. You're going to put your arms around people. You're going to love them because that's who we are. That's what we do. That's what I grew up with. And so when you do that, you increase your body's immunological response. There was a guy by the name of Leo Buscaglia. Leo Buscaglia was a professor out in California, and he wrote a book, Bus 9 to Paradise. And he was talking about how these emotional, crazy Italian people would always have these emotional pieces to them, and that, they talked about hugging and kissing and, but we're not talking about a sexual thing here. We're talking about loving people and being present with them. But guess what it does for you? It upregulates your immunological function, number one. Number two, it increases your body's red blood cell count and oxygen transport systems in your body. Nothing more than that, man. You've already done a great amount of things. Guess what happened was during COVID, and we weren't around people. We were depressed. We didn't hug anybody. We didn't do anything. And you think that didn't take a toll? I'm telling you, be the keeper of your thoughts. Be the keeper of your thoughts. Stinking thinking, get rid of the stinking thinking. Don't allow yourself go, stop, and then put something else in it. Reprogram the words that you use. Words have impact and force. And there's a very dear woman who is close in my life. One side of your mouth, you can't take it back. And that's even for you. So you have to make sure that you police the words that you put out there. Now, so we're giving you a lot of small pieces of the puzzle here that you can really make a difference with anything that you do. So why don't we do them? How come? Do we sit on our butt and the only thing that we do is flick to, bad channel after bad channel, bad channel? How many of you play games, word games, and learn how to express something differently? Why don't you try this? Why don't you take one new word every 3 days? Every 3 days. and like you're a kid, and then use that word. So word you didn't know, or word that you didn't really understand, and apply it properly, and then see how often it's used in different things. I promise you that'll make a difference. You know, a word that years ago that I wasn't quite sure of, and I didn't realize the full expression of it, was the word to peruse. Do you know what the word to peruse means? You say, I gave you a bunch of papers you're working from. I said, peruses, we'll talk about it in the morning. What does that mean to you? Well, the word peruse, most of us think is just kind of skimming through and becoming familiar with, and so we can at least have some reference to it. It actually means to study in depth. Isn't that cool? And so when I was in college, we had these 1,000 vocabulary words. So I had 3 roommates, and so we would all pick a word every other day, and we would try to learn something different. Yeah, it worked for a while, and then we got bored about 6-7 months into it. But guess what happened during that period of time? It actually taught us a technique that we wouldn't have had otherwise. So learn word games, those crossword puzzles and word identifications and so forth, but don't get hooked on them. Give yourself a small period of time that is going to be the same time all the time, and do it then. Listen to music, learn math games. Now, I've always told patients, write, not on the computer. You want to write on paper, and then write about the things that are happening. If you're upset with something and you write it down and put all the details, all the ugly pieces that could be involved with it, and just do a brain dump, guess what happens? You can reprogram the impact it has on you. It dramatically decreases its, and pretty soon, if you continue to express it, you'll get rid of it. Some of you will have to remind you about it after a later point. So isn't that simple? Here's another one. Write love letters to yourself. Yeah, say, dear Carol, I want you to know you're the most amazing, beautiful, wonderful person. I love all the talents, and list the talents. You're creative, you're a great cook, you're doing things that help other people. You're amazing. I love you so much, Carol. And you sign it to yourself, and you direct it to yourself. That has also an amazing impact to what you're going to do ultimately. The little things make huge, huge, huge impact effect in your system. But you have to make sure that you calm the system down. You can look out and say, we'll take these medications, a lot of vitamin B complex, which works. You're going to take this calmative herb, and that works a little bit, but it doesn't reprogram the brain necessarily. It may increase the capacity of your brain, but it doesn't necessarily fix anything. So make a list. What are you going to do this week that's going to be different? There's a book that I really like reading. Is the author's Robin Sharma, and it's called The 5 O'Clock Club. And the other one is called The Saint, the Surfer, and the CEO. I think that if you read those books, you really enjoy it. You can do it on audio and so forth. And he talks about how people who are really at the top of their game and continue to keep themselves in a healthy way in the 5 O'Clock Club really show up at the top of their game all the time. But there are serious signs. I want you to remember these. When your nervous system is not working, is dysregulated. Anxiety is one of them. You're uptight about anything. Panic attacks. You're not remembering things. Cognitive problems. You can't concentrate anymore. You're depressed all the time. You have stuff happening in your body. You can't sleep. We talked about that. Irritability. You want to explode, right? And the chronic stress that you put yourself under are triggering things, addictive tendencies. Even watching the tube, even on your games, you have to have control over you and set it aside. If you don't, you're asking for trouble. So if we understand these are the things that are happening, why is it that we kind of set it aside? The sympathetic system, the fight-flight system, activates acute stress responses. We call it fight-flight. So if we know that, don't you think it would be great to put ourselves in a place that we down-regulate that combative process? that we give ourselves, and not just go work at something, but just give us some moments of relaxation. I'm here to tell you that a lot of you, even if I took your stress patterns away, you wouldn't know what to do to calm yourself. You wouldn't know that listening to good music, like, classical music, like Bach's Fifth, like um, the string quartet music and so forth, that regulates brain in a positive way, are good for you. No, you're going to go listen to the stupidity that's on the television, all the talking heads, instead of just being calm and relaxed. So when we're looking at how the nervous system works, we want to have a balance between parasympathetic, which is, I want you to think is repair, and I want you to look at the sympathetic system. So when we get that and you're willing to take control of your thoughts, we want to put ourselves into a regulated ease, if you will, pattern. So we have to make sure that we do that. We have to make sure that the limbic system, limbic has to do with your emotional system, is working the way it's supposed to. You're supposed to be in a state of love, not in a state, I want to rip that guy's head off and shove it where it might be a dark place. You don't want to do that. You want to catch yourself and make sure you don't do those things. Limbic dysregulation is horrible when it comes to putting us in a place where we become paralyzed, basically. So what do we want to do? Again, I gave you some tools. They're not just slight tools. They're really good tools. Give people hugs, put your arms around them, but do it in a way that you're just being present with another human being, and you're being present for them in your life. That increases that love hormone called oxytocin, and concentrate on things that are positive. Be your own police. Be your own thought police. And when bad stuff go, nope, 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 and replace it with a positive something. So we have to make sure that we ongoingly give ourselves tools, if you will, to shift, to change, to make a difference. Because if we don't do that, we can't reprogram anything. So other things you can do. We talked about travel. We're talking just go a few miles, go someplace where it's quieter. Learn a different language. As I said early on in the program, that my family's language was Sicilian. I grew up with both languages until my grandfather died. And then guess what? Nobody spoke the language in the house again. I grew up with English. I recognize some of it, but I'm in a place right now in my life, I got to increase my brain. So what I'm doing, I'm going back and I'm trying to learn a few words again and so forth. And then how about making music? We talked about listening to music. Why don't you go learn an instrument? Go get a keyboard. Go get some drumsticks and learn how to drum out a beat. Do something different and re-regulate your system. Don't get too hooked on what? Don't get too hooked on the videos. Don't get too hooked on your cell phone. Don't get too hooked on, all the online stuff. Take it into a quiet place. I hope that helps you. And I'm not just tossing things out. These are simple ideas. Yeah, I can get you. I can do NET, neuroemotional technique. I can teach you how to do some of those things. If you have a problem where you're in an anger place, take your right hand fingers over your left hand like this, and see where my fingers are. And then you're going to put the hand over your forehead. That's where your emotional centers are. And get really quiet and just sit there for a minute. Let that anger dissipate. Let it go away. And you'll find that when you're upset like that, if you do that, find a quiet moment, get away from everybody. This is by yourself. This is all by yourself. You'll find that can make a big difference. We talked about regulating the vagus being the primary 10th cranial nerve throughout the whole body, right? What do we do with that? We said, sit quietly, right? Like this, and then squeeze your toes down, and then at the same time, do a Kegel, like you're going to hold yourself from having a bowel movement or urinary, whatever. And then you're going to take your tongue and you're going to tickle the top of the roof of your mouth and do it 100 times a day. You will reprogram that vagal expression. And since that's the mother of all hormone, and I said early on, do another one, put your tongue above, the back of your teeth, go la 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 la, and then put it way back of your throat and go ga 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 like that. And if it's not as strong or as struggling, and so it tells you that you got an injury perhaps at the back of your neck. But you can also help yourself by doing that on a regular basis. I showed a patient the other day another way of reprogramming. You know how you do this with your fingers? Right? So why don't you try it a different way? Do one side starting here, do the other side starting here, and you're going to do this. Okay, got it? How many of you can do that? It's kind of cool. I'll bet you can't. So let's do it one more time together. Like this, like this, like this, like, okay, so we're going to go. I got to stop looking in the camera. So we're doing this, right? And like this, little finger, thumb, index finger, thumb. And then we're going to do what? We're going to do the next finger, and then we're going to do the next finger, and then we're going to do the next finger, like that. And then get good at it so you don't have to look at them. And then we'll go backwards again, right? And then we'll do this, and then we're going to do this. Cool? Try that until you can do it automatically. When I slow it down, it's a little bit of a challenge, but I can get it done. So we're going to do this, right? And we're going to do this, and we're going to do this. Try that and do it all the time. And I promise you, you'll regulate. And then try it as you're listening to music. And I promise you, you're going to be surprised at what takes place. I hope all this helps you. These are little tools, things that you can do that I promise you will work. And think about what we just talked about. We talked about la, 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 la. We talked about your toes, your perineum, and the roof of your mouth. We talked about writing. We talked about love letters to yourself. We talked about expressing the beauty of it, listening to music. We talked about doing this neurological process that I just showed you. Put all those together, and I promise you, you do it without fail several times a day. Go for a walk 2 miles a day, and just doing those things, I promise you, you'll begin to shift and change. And remember, I'm here on a weekly basis for one reason only. I want to give you all the information I can possibly give you so you can help yourself, but also so you can ask the right questions to the practitioner that you go see if you need some help in taking a step that you can't do on your own, whether it's me or it's somebody else. It's whatever doctor you go to. If you understand these little pieces of the puzzle and you know where to find them and get the references on them, you're going to know more than they do. I promise you that. Having said that, I hope it's useful. Join us this coming Wednesday evening, the 11th, at the Roselle Center for Healing in Fairfax. And I promise you it's going to be an amazing night. There's 3 of us. We're going to go back and forth, back and forth, back and forth, and give you all the information that you deserve to have when it comes to diabetic neuropathy and injury neuropathy and stenosis neuropathy and so forth. But we're going to show you how it can be fixed too. We're going to show you what can be done. Having said that, remember, I'm here every Sunday for you on a weekly basis for one reason only. You deserve the data, but more importantly, I love you all. Have a great day. See you later. Bye.